محاضرتنا اليوم بعنوان Normal Pregnancy and Antenatal Care. Pregnancy is the physiological process of a developing fetus within the maternal body. The period of gestation can be divided into units consisting of 3 calendar months, each of 3 trimesters. Early pregnancy equal or less than 12 weeks. Late pregnancy from 13 weeks to 27 weeks. Late pregnancy equal or more than 28 weeks. Term pregnancy from 37 weeks to 42 weeks. Clinical findings. Sign and symptom. Amenorrhea. The meaning of amenorrhea is cessation of mens caused by hormone. Amenorrhea. The meaning of amenorrhea is cessation of mens caused by hormones estrogen and progesterone. Nausea and vomiting is common symptom in about 50%, being at 2-week gestation age and resolve at between 13 to 16 weeks of gestation. Frequency of maturation due to increased plasma volume, increased urine production, and the pressure effect of the uterus on the bladder. Lassitude or fatigue, common in early pregnancy, tend to disappear after 12 weeks of gestation. Breast changes, as breast tenderness, breast engorgement, Montgomery tubercles, and colostrum secretion. Fetal movement. The initial perception of fetal movement. The initial perception of fetal movement. The initial perception of fetal movement at 12 to 20 weeks in primiparous women, and as early as 14 weeks in multiparous women. Maternal perception of movement is called quickening. As glioasma, linea nigra, stria gravidarum, and spider-telangiectasia. Pelvic organ changes. Bluish discoloration of the vagina and the cervix due to congestion of the pelvic vasculature, widening and shortening of the body of the uterus at 6 to 8 weeks of gestation. Also softening of the cervix. Leukorrhea, increase in the vaginal discharge, secondary to hormonal changes. Secondary to hormonal changes. Abdominal enlargement. There is progressive abdominal enlargement with growth of uterus during pregnancy. Uterine contraction. Painless uterine contractions, Braxton Hicks contractions, are felt as tightening or pressure. Diagnosis of pregnancy. First, by signs and symptoms that we talk about. Second, by what pregnancy test. These are immunological tests to detect beta-HCG in the urine and in the serum. Beta-HCG is produced by the syncytial trophoblast 8 days after fertilization. May be detected in the serum 8 to 11 days after conception. May be detected in the serum 8 to 11 days after conception, or 21 to 22 days after the last menstrual period. Peak of beta-HCG at 10 to 12 weeks. 3. Imaging studies. Sonography, fetal cardiac activity, is detected via transvaginal sonogram at 5 to 6 weeks. 4. Fetal heart tones are detectable by handheld Doppler after 10 weeks gestation. Uterine size. Fetal palpation. Uterine size can be used to diagnose pregnancy secondary to uterine enlargement. Late in pregnancy, the fetus can be palpated. Gestational age determination. Gestational age determination. Pregnancy has been historically dated from the last menstrual period, LMP. The median duration of pregnancy is 280 days, that's to say 40 weeks, and this gives the estimated due date of delivery. This assumes that the cycle length is 28 days. Ovulation occurs generally on the 14th day of the cycle. The cycle was normal cycle, that's to say, not straight after stopping the oral contraceptive pill or soon after a previous pregnancy. Nigel's rule: the estimated due date is estimated by adding 7 days to the first day of the last menstrual period, and subtracting 3 months plus 1 year, or by adding 7 days and counting forward by 9 months. Gestation calculator is in most antenatal clinics. There are pregnancy calculator wheels that do this for you. Number 2, ultrasound between 8 and 13 weeks. It provides the most accurate measurement of gestational age via crown rump length, CRL. Here, the gestational calculator or the wheel can be calculate the date for us. This is the weeks, this is the months, date. Here by ultrasound, as we said, crown rump length measurement. This is the face. The medical care, history, examination, investigation, treatment, and other preventive measures, which should be given to a woman before labor. Objectives of perinatal care. Number 1. To prevent, detect, manage those factors that adversely affect the health of the mother and the baby. Number 2. To provide advice, reassurance, education, and support for the woman and her family. Number 3. To deal with the minor ailment of pregnancy. Number 4. To provide general health screening. Assessing antenatal care or booking visit. The booking history. First, medical history about any cardiac disease, renal, diabetes, rubella, and other medical illnesses. Surgical history, family and social history about DM, hypertension, twin hereditary disorders. Past obstetrical history about premature labor, abortions, intrauterine death, difficult labor, cesarean section, postpartum hemorrhage, fetal weight, etc. Gynecological history, history of present pregnancy, date of the last menstrual period, regularity of the cycle, the use of hormonal contraception, any symptoms like nausea, burning, micturition, vaginal bleeding, and etc. Booking examination. For most healthy women without complicating medical problems, the booking examination will include the following. First, accurate measurement of blood pressure. Second, abdominal examination to record the size of the uterus. Third, recognition of any abdominal scars indicate a previous surgery. Fourth, measurement of the height and weight for calculation of the body mass index. Women with a low body mass index are at a greater risk of fetal growth restriction, and obese women are at significantly greater risk of most obstetrical complications as gestational diabetes, preeclampsia, emergency cesarean section, and anesthetic difficulties. 5. Urine dip testing for protein, glucose, leukocyte nitrate, and blood. Booking investigations. Booking investigations. Whole blood count is a screen for anemia, thrombocytopenia, both of which may require further investigations. Blood group. A blood group is checked at booking to identify rhesus D negative women, so that they may be informed regarding the risk of rhesus isoimmunization and desensitization from a rhesus D positive fetus. Hemoglobin studies with thalassemia and sickle cell disease are carried in an autosomal recessive fashion. Rubella screening tests are performed by serology to detect antibodies against rubella. Hepatitis B. Detection of the antibody implies immunity to hepatitis B. Hepatitis B surface antigen indicate the presence of hepatitis B in the blood. Hepatitis B core antibody or anti-hepatitis core indicates a person that may have exposed to hepatitis B virus. Human immune deficiency virus HIV screening test serology to detect antibody against HIV. Syphilis by VDRL Venereal Disease Research Laboratory or rapid plasma reagent. Urine analysis midstream urine sample early in pregnancy to detect asymptomatic bacteriuria, which is common in pregnancy. Treated with increased risk of preterm delivery and the development of pyelonephritis during pregnancy. A midstream specimen of urine should be sent for culture and sensitivity. At the booking visit should be sent for culture and sensitivity. At the booking visit to screen for asymptomatic bacteriuria. Urine analysis is performed every antenatal visit. Urine is screened for protein to detect renal disease or preeclampsia, persistent glucosuria to detect the pre-existing diabetes or gestational diabetes mellitus, and nitrate to detect urinary tract infections. If nitrate are detected on urine dipstick testing, midstream urine is sent for macroscopic cultural sensitivity to detect asymptomatic bacteriuria and appropriate treatment initiated if a positive culture is identified. Evidence base does not support routine screening for bacterial vaginosis, cytomegalovirus, toxoplasmosis, hepatitis C, group B, streptococcus, cytomegalovirus, toxoplasmosis, hepatitis C, group B, streptococcus, colonization or chlamydia, cervical smear, and vaginal swab are not routinely taken. At the booking visit, however, smears should be performed during pregnancy on women with an abnormal cervix on examination. For fetal abnormalities, Down syndrome. Essentially, they include a nuchal translucency scan at 11 to 14 weeks gestation, with or without biochemical test, or biochemical blood test is in isolation at 15 to 20 weeks of gestation. Neural tube defect as spina bifida and anencephaly, with maternal serum alpha-fetoprotein level at 15 to 20 weeks of gestation. Structural congenital abnormalities by ultrasound examination. Structural congenital abnormalities by ultrasound examination at 11 to 20 weeks. At 12 to 20 weeks, Clinical conditions later in pregnancy. Gestational diabetes mellitus. Universal screening for gestational diabetes mellitus is available in some countries, including the USA and Australia. However, NICE advocates risk-based screening in the UK. Gestational diabetes mellitus is diagnosed by a woman who has fasting plasma glucose level of 5.6 millimole per liter or above, or 2-hour plasma glucose level of 7.8 millimole per liter or above. For the development of gestational diabetes mellitus. Previous gestational diabetes mellitus. Previous macrosomia equal or more than 4.5 diabetes mellitus. previous macrosomia equal or more than 4.5 kg, raised basal metabolic, raised body mass index more than or equal 30 kg per square meter, first degree relative with diabetes, women of Asian, Black, Caribbean or Middle Eastern origin. If these factors are present, the woman should be offered a 2-hour 75-gram oral glucose tolerance test, or at 24 to 28 week gestation. Women with a previous history of gestational diabetes mellitus should have an oral glucose tolerance test at 16 to 18 weeks gestation. The test should be repeated at 24 to 28 weeks of gestation. Preeclampsia. All women should be screened at every antenatal visit for preeclampsia by measurement of blood pressure and urine analysis for protein. Preeclampsia by measurement of blood pressure and urine analysis for protein. Preterm birth. Only women with a history of preterm birth are routinely offered screening tests for preterm labor such as bacterial swab or cervical length scan. For vitamin D deficiency in pregnancy, but guidance states that all pregnant women plus breastfeeding women should be advised to take 10 micrograms of vitamin D supplements daily. And well-being. Symphysiofundal height measurement should be performed with a tape measure at every antenatal appointment from 25 weeks gestation. Concern that the fetal growth may be slow or has stopped should be assessed by ultrasound scanning. Fetal growth may be slow or has stopped should be assessed by ultrasound scanning. Listening to the fetal heart at each antenatal visit in the second and third trimester with a penile stethoscope or Doppler using, but it is no longer supported. As we see, symphysiofundal height measurement by a tape measure. Follow-up visit or subsequent visits. The frequency is dependent on the gestational age, maternal condition, and any fetal complication. The standard schedule in uncomplicated women is every 4 weeks from 0 to 32 weeks, then every 2 weeks from 32 to 36 weeks, and then weekly after 36 weeks. At every visit, symphysiofundal height should be measured from 25 weeks gestation. Maternal blood pressure, urine analysis for lipstick, maternal weight should be documented. Fetal presentation and degree of engagement should be assessed from 36 weeks. For high-risk pregnancy, more frequent visits may be required. What is the most common problem detected in routine antenatal care? What they are: hypertensive disorder of pregnancy, anemia, abnormalities of uterine size, small for date or large for date, abnormal fetal presentation. Other issues related to pregnancy: dental care. There may become hypertrophy and gingival bleeding during pregnancy. Normal dental procedures as cleaning, filling are performed in pregnancy. Normal dental procedures as cleaning, filling are performed under general anesthesia. Immunization. Both virus, toxoid, or recombinant vaccine produced through recombinant DNA technology may be given during pregnancy. Liver attenuated vaccines as rubella, measles, mumps, polio are contraindicated in pregnancy. Secondary prophylaxis with immunoglobulin is recommended. For the pregnant women exposed to measles, hepatitis A, hepatitis B, tetanus, chickenpox, or rabies. Travel by automobile, train, or plane does not adversely affect pregnancy. Nutritional requirements. The pregnant mother should be encouraged to eat balanced diet with special need for iron should be encouraged to eat balanced diet, with special need for iron, folic, and calcium and zinc. Labor or vaginal bleeding should be avoided coitus until evaluated by her clinician. Education about pregnancy, labor, perinatal, and infant care. It is an essential part of antenatal care to ensure optimal outcome. It is important, essential, and primary the woman. Labor and pain control options during labor. Visit labor room and introducing the patient to the labor room staff.